This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. So far this year, there have been 465 cases of measles in 19 states. The CDC says this is the second greatest number of cases since the disease was eradicated back in 2000 in the United States. How did we get here? Today, Where We Live, we'll talk about why measles, a highly contagious virus, is spreading in the U.S. and talk about the reasons behind why some Americans are choosing not to vaccinate their kids. Should doctors and public health officials change how they communicate with parents about routine vaccinations? And what does this rise of measles mean for people who can't get immunized because of health issues? We'll talk with the epidemiologist about the impact on what's known as herd immunity. You can join us too. Here's the number, 860-275-7266. As always, find us on Facebook and Twitter at Where We Live. I want to welcome our guests to the show. My first guest is Donald McNeil Jr., a science reporter for the New York Times. He covers global health and infectious diseases. Donald, welcome to our show.
Thank you very much.
Also joining us for the hour is Dr. Lisa Saman. She is a hospital epidemiologist at New York Presbyterian Hospital, a subspecialist in pediatric infectious diseases, and also professor of pediatrics at Columbia University Irving Medical Center. Dr. Saman, welcome to Where We Live.
Thank you so much, Lucy.
I wanted to start with Donald. Here in Connecticut, especially, many people are following this measles outbreak in certain neighborhoods in New York City, also north of the city. Can you tell us what's happening there, and how long has this outbreak been going on?
It started in October. It's mostly in Orthodox Jewish communities now, but there's no reason it'll stay in them. It started almost simultaneously in Brooklyn, in Hasidic communities, and in Rockland County, where there's a big Hasidic population, in families who came back from Israel, when Israel's having a sizable outbreak, not a huge one, but one of 7,000, 8,000, 9,000 cases. And so families who hadn't vaccinated their kids against the virus picked it up and brought it here, and it started spreading. And it's still on the increase. So, you know, we're on track to break the record for measles in this country post 2000, when it was supposedly eradicated.
We've heard from Mayor de Blasio declaring a public health emergency for certain neighborhoods where these Orthodox Jewish families are living. When we talk about the number of cases, what do we know as of today? How many have been reported?
I'm not sure the exact number today. I think there were another 80 reported just recently, but we're in the 400 or so. We're in the 300 or so range in New York. It's in the hundreds. It's basically what's worth knowing, and it's likely to increase. And what's happened in response has been extremely unusual. Rockland County declared that nobody who hadn't been immunized couldn't leave their house, couldn't go out, not go to school, but can't go to playgrounds, can't go to movie theaters, can't go to grocery stores. That's obviously going to be tough to enforce, but they're going to enforce it by finding out later, after somebody has a measles outbreak in their family, that they came out at a time they weren't supposed to come out to, and they can potentially be punished. And de Blasio did something even more extraordinary, which is he actually called for forced vaccination. Now, this is not grabbing people off the street and sticking needles into them, but this is families who don't vaccinate can be fined up to $1,000. And the way they'll find them out is they're doing contact tracing. Now they're going to families that have had measles outbreaks and looking to see who's been vaccinated and also who they've been in contact with. That's tough in a measles outbreak because, you do contact tracing for everything from Ebola to syphilis. For measles, with syphilis, contact tracing is looking for people that somebody's had sex with. But for measles, you can pass it by walking through a supermarket. You can pass it by, walking through an airport. So it's very hard to trace all the contacts, but they're trying.
You mentioned Rockland County and an order to keep unvaccinated children out of public spaces. We believe a judge has blocked that order, that part of the order?
Yeah, that's right. A judge has blocked it. Inevitably, and also a lawsuit's been filed in New York City. I mean, anytime a government gives an order, somebody files suit and tries to get an order to stop it. President Trump is having a few frustrating moments with this tendency of Americans to go to court right now. But, we'll see what happens.
Dr. Saman is with us. Tell us what exactly measles is and how contagious is it?
Mm-hmm. So measles is a virus, and it's spread through the respiratory route. So as Donald was describing, when there's somebody that has measles, one of the prominent symptoms is coughing and sneezing, and that releases little droplets of infection, And when a susceptible person, somebody that hasn't been vaccinated or is too young to get vaccinated, comes in contact with those droplets, either in their mucous membranes of their mouth or their nose, or actually breathes in the particles, they can become infected. Measles is one of the most infectious viruses, so it only takes a handful of particles to infect a person.
So as contagious as a common cold, Dr. Seaman?
Yes, even potentially more infectious. The other thing, Lucy, pardon me for interrupting you, that I think is really important and again echoes something that Donald said, the measles virus, those particles that get released are incredibly light and they can remain in the air for upwards of 2 hours. So the idea would be that somebody infectious was in the area, left that area, but if somebody who was non-immune came into that area within 2 hours, they could still get infected.
That's pretty scary, but to think about that it's that contagious as well as persisting in the air a couple hours after someone has left, that is contagious. I wanted to go back to reporter Donald McNeil Jr., a science reporter for the New York Times. You've covered global health and infectious diseases for many years. We talked about that year 2000 when measles was eliminated from the U.S. What were some of the factors that led to that, Donald?
Vaccination. That is the factor that led to it. I mean, in those days, more people had memories of kids who had measles. A lot of them had measles as kids. I presumably had measles as a kid because I'm born before 1957. And it was not an inconsequential disease. Yes, 19 out of 20 kids came through it just fine with some spots, and they were miserable for a few days. One out of 20 kids went to the hospital. 1 out of 1,000 kids died. People have just forgotten in this country how serious some of these diseases are. But, I travel all over the world covering diseases. I've met, Americans have no idea how lucky they are that they have access to these vaccines. I've met lots and lots of polio victims, and it's no fun to have polio. It's awful, and you wouldn't wish it on your child. And I've also met parents who are crying out, angry at the polio vaccinators because they're saying, you're bringing us polio vaccine and that stopped. Bring us measles vaccine. That's what our kids are dying of. So people in other countries are begging for this vaccine, and they also know it's relatively harmless, almost entirely harmless. And because they see measles deaths, they're afraid of the disease. But we've lost that in this country.
Obviously, vaccination, but billions of dollars, a campaign by the UN to look at ending measles worldwide. Talk about just the combination of factors that led to these widespread vaccination campaigns that we have vaccinations today, but now we're seeing measles cases going up.
Well, the UN didn't need to come to the United States to tell us to vaccinate. The vaccine was invented here, and the medical system spread it out, through family doctors, pediatricians everywhere. But the UN did in consultation with the Gates Foundation and Ted Turner's Foundation and the CDC and American Red Cross, is put billions of dollars into spreading the vaccine around the world, starting in about 2000. Measles is one of the leading causes of death for children under 5 in the world. It used to be that 10 million kids died every year before the age of 5. Now it's down below 5 million, and a big part of that is because of measles. And so it steadily went down from about the year 2000 to about the year 2016. It went down. Measles deaths went down by 80%. And the billions went for buying vaccine, for training vaccinators, for buying refrigerators and things in order to keep the cold chain going. And then in the year 2016, suddenly you got a jump up in measles cases. And it's for a lot of reasons. It's not just because of the vaccine skeptics at all. I mean, the number one reason is because of poverty. Poor countries have a very hard time vaccinating all their children. What you do is you do giant measles drives and you try to vaccinate every kid you find. You don't do what we do in America, which is sort of routine vaccination. Kids go to the doctor every month or 2 months for the first couple of years of their life, and they get their shots. In other countries, it's tough to keep up these constant measles drives when you have new kids being born all the time. And if you let it slow down for a few years, you get thousands of kids, millions of kids in some countries are born, and those kids become a new pool of susceptibles. And once somebody brings in the virus, it's like throwing a match into a pile of matches. They all catch.
Donald McNeil Jr. is a reporter for the New York Times, joining us from a studio there. Also with us, Dr. Lisa Sayman, who's a hospital epidemiologist at New York Presbyterian and professor of pediatrics at Columbia University, as we talk about why some Americans are reluctant to immunize their children. We want to hear from you as well. The number 860-275-7266. You can also find us on Facebook and Twitter at Where We Live. When we look at other places in the world, Donald, where there have been measles outbreaks, obviously you mentioned poverty being a factor, but in places where there's conflict, like in the Ukraine, how has that impacted public health?
The public health system falls apart. I mean, there are measles outbreaks going on right now in the Ukraine, where there's a Russian-supported revolution in the east. There's a giant measles outbreak going on in Yemen, where there's a civil war being fought. There's a big outbreak going on in Madagascar, which is just an extremely poor country. It's a huge island off the coast of Africa, and they hadn't had measles there since 2003. So when it came back, you had a big pool of susceptibles. There was a big outbreak in Somalia, which is war-torn, and that's because of conflict. On the other hand, there was also an outbreak in the Somali community in Minneapolis, and that was because a number of years ago, it became clear that there were very high rates of autism among the Somalis in Minneapolis. There is no word in Somali for autism. They were just stumped as to why this was happening. And the anti-vaccine wackos came in there and told them all it was measles vaccine and you have to stop vaccinating your kids. And there was a sort of battle within the Somali community, and some said this is wrong and pay no attention to it. And others got afraid. They stopped vaccinating their kids. And 2017, there was a big outbreak of measles in the Somalis there. There are many reasons why you get outbreaks, but all you really have to do is create a pool of susceptible people and wait for the virus to arrive, and it will spread. It doesn't care about race, religion, ethnic group, or anything else. But it's more likely to kill you if you're poor and you're undernourished and you can't get good medical care. The death rates in countries like Madagascar are closer to 1 out of 10 or 1 out of 20 cases, whereas in the United States or England or France or other places that are having outbreaks, it's more like 1 in 1,000.
Donald, we talked earlier about this public health declaration in certain neighborhoods in New York City. Mayor de Blasio putting out a mandatory vaccination, and if people don't get their kids vaccinated, they could get a fine. How legal is that?
It's legal. I mean, you'd be astonished at how tough the public health laws in this country really are, because most of them were written in the 1800s when we had regular outbreaks of yellow fever and cholera and smallpox. And health inspectors can go to your house and put a policeman outside the door and slap a quarantine notice on your house and say, this house has smallpox, nobody comes in, nobody goes out. They can take you forcibly into a hospital and, give you antibiotics. We actually did this in the 1990s during an outbreak of multi-drug resistant tuberculosis. Former health commissioner of New York back in the 1800s during a cholera outbreak was asked by a congressional committee, what are the limits of your power? And his answer was, I can seize City Hall and turn it into a hospital if I feel like it, if I think it's necessary. The law allows me to do that. So there's a 1905 Supreme Court decision in the case of Jacobson versus Massachusetts, where a pastor in Massachusetts did not want to have smallpox vaccine. Massachusetts had a compulsory law. Now, he wasn't forcibly vaccinated, but he was fined $5 for refusing, and the case went all the way to the Supreme Court, and the Supreme Court ruled that, yes, he was properly fined the $5, and that was fine, and he could even have been jailed, but it didn't say he could be forcibly vaccinated. But that's partially because Massachusetts law didn't allow it. Actually, forcible vaccination has been used in Philadelphia in 1991 during a measles outbreak there.
Donald, at this point, we don't know how aggressive New York City will be, considering this public health emergency declaration was just put into place on Tuesday, and just to see what the efforts will be from the city to try to enforce it.
Yeah. I mean, you're not going to be able to march down the streets and grab people and say, show me your vaccine certificate. One, it's ridiculous and impossible. And two, you'd fall right into the trap that the anti-vaccine people are laying with trying to get people to wear, yellow Star of Davids with the words anti-vax on them in mock Hebrew letter, something that the Anti-Defamation League finds incredibly offensive. What they're trying to do now is do contact tracing in families that have had outbreaks and find out if they ignored the order. order. And if they ignored the order, then they're liable for the fine. The city is hoping not to have to punish anybody. They're hoping to use this as a way of convincing people, hey, we're serious. Let's get vaccinated. Saying please hasn't worked. Offering education hasn't worked. So now they're beginning to use the stick. The stick could get bigger, but they're hoping not to have to use it. They're kind of ramping up.
Donald McNeil Jr. again is science reporter for the New York Times. He covers global health and infectious diseases, joining us today from a studio there. Donald, thank you for your time.
Thank you. Thank you for inviting me.
From Connecticut Public Radio, this is Where We Live. I'm Lucy Nalpathanchel. We're going to continue our conversations about the measles outbreak being seen in communities in the United States, also worldwide. What's your response to the outbreak close to home in New York and New York State? Did you have questions about childhood immunizations? How did your doctor respond? Later, we'll be talking about how medical professionals should talk about routine immunizations when misinformation is so readily available online. Our guest, Dr. Lisa Sayman, will be with us for the hour, and you can join us too. Here's the number, 860-275-7266, or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. New York City, as we've heard, one of the places that's seeing a rise in measles cases. CNN reported that the city has seen nearly 260 measles cases as of last Friday. Here's New York City Mayor Bill de Blasio on Tuesday declaring a public health emergency in a heavily Orthodox Jewish section of Brooklyn amid a growing outbreak there.
To give you a sense of what a troubling development this is, it's a huge spike. We saw only 2 cases in New York City in 2017. So we have a very serious situation on our hands.
Now, are you worried about this disease making a comeback? Should doctors change their strategies when talking about immunizations? And should local governments go from encouraging to mandating routine vaccinations? You can join our conversation, 860-275-7266. You can find us on Facebook and Twitter at Where We Live. My guest is joining us from NPR's New York studio, Dr. Lisa Sayman. She's a hospital epidemiologist at New York Presbyterian Hospital, also professor of pediatrics at Columbia University Irving Medical Center. Dr. Sayman, what was your reaction to Mayor de Blasio's announcement just a few days ago?
Well, I was amazed. I've been doing work in hospital epidemiology for over 2 decades, and as was alluded to by the mayor, we've never seen an outbreak this large. What I really want the listeners to understand is how serious measles can be, and measles can cause pneumonia, particularly in young children. Measles can cause an infection of the brain called encephalitis, which can occur in adults or children. And the other issue that is very important in the perspective of public health people and people like me that work in hospitals is that unfortunately we have many very vulnerable people who can actually not get vaccinated, who we put at tremendous risk during an outbreak. So, for example, little infants cannot get vaccinated. They're too young. Pregnant women cannot get vaccinated because we don't use live viral vaccines. And people that are immunocompromised, for example, somebody getting chemotherapy for cancer or somebody who has received an organ transplant, are very, very susceptible to getting severe measles. And so the other part of the vaccination strategy is to protect the most vulnerable among us. People may not know that if a pregnant woman gets measles, she herself is at risk of getting pneumonia and a brain infection and even dying. She's also at risk of a miscarriage or having a premature baby. And measles can get transmitted to the unborn child, and the baby can be born prematurely.
Dr. Sayman, could we talk about the MMR vaccine? Many people are familiar with it, the vaccine created in the 1960s. So tell us exactly what's in it. How does it work?
Mm-hmm. So measles, mumps, rubella, MMR, and the listeners may also be familiar with MMRV. The V stands for varicella, which causes chickenpox. And we give the MMR or the MMRV to all children between 12 and 15 months of age It's very, very safe, and greater than 95% of the time, a child will become immune, meaning that they will be protected. We then give a booster at 4 to 6 years of age in order to get that last few percent, so that we have almost 100% of the people that we give 2 doses to are now immune. So what a vaccine does is this. When you give a vaccine, which is what we call a live attenuated, meaning it's a weakened virus, it doesn't cause measles. Very important for the listeners to know. The vaccines do not cause the actual virus that you're vaccinating against. You allow the body to make special proteins called antibodies that are directed against that virus. So if in the future a person were to encounter the real measles, they would already have these preformed proteins called antibodies directed against the measles, as well as other white blood cells that would help them fight the measles, and they would not get sick.
You can join our conversation today on Where We Live. My guest, Dr. Lisa Saman, who's a hospital epidemiologist at New York Presbyterian Hospital. We're talking specifically about the outbreak of measles seen close to home in New York State, also as far away as Washington State. Measles outbreaks are also becoming more common worldwide in certain countries that had also seen it eradicated. Here in the U.S., no measles back in 2000. Now the cases are alarming public health officials like Dr. Lisa Saman. You can join our conversation, 860-275-7266. Barbara is calling from Avon. Barbara, go ahead.
Thank you for taking my call. I have two questions. Is there a heavy metal in the form of aluminum that is in the vaccine to prolong the shelf life?
And Barbara, what's your other question? I'll have Dr. Saman answer both of them.
And the other question is, the regulating agency that has a contract or maybe a commitment to check on the safety of the vaccine, are these tests being done routinely as they are supposed to do?
All right, Barbara, thank you for your questions. First up, Dr. Saman, she was asking about a metal found in these vaccines to extend shelf life. Tell us about that.
Yeah. The concern of the heavy metals was actually linked years ago to the concern about autism, which has been debunked. There is no association with the measles vaccine and autism. That has been very, very well studied by many groups. And one of the concerns was the heavy metal, so they were taken out. So there is no heavy metals in the vaccines. And then there are very strict regulatory guidelines during manufacturing to ensure that there's safe preparation and to ensure that the measles viruses within the vaccine are that attenuated, weakened form that I described before. And in addition, very strict regulations for the shipping and storing of the vaccine to ensure that it retains its potency, so when it's actually administered to a patient, it works. So this is very, very closely regulated.
We're going to take some more calls in just a couple of minutes, but I did want to ask you, new parents especially worry about adverse reactions, especially as their infants are getting immunizations every couple of months, every few months. What kinds of reactions can happen from getting a routine immunization? And when people raise these concerns, how do doctors respond and try to allay those concerns?
Lucy, it's very important that pediatricians and other people giving vaccines do anticipatory guidance for their patients, explaining what the possible side effects might be. So especially for new parents, they understand what they can expect. It's also important for the listeners to understand that the adverse effects are quite rare. Generally speaking, the most common adverse effect is pain at the site of the injection, sometimes some swelling and some redness. Some babies may get a fever from a vaccine, and some babies, very few, about 1 in 100 to 1 in 200, may actually get a slight rash from the measles vaccine that can occur within a week after vaccination. It's important to recognize that rash goes away quickly and is not infectious.
You can join our conversation, 860-275-7266. Richard's calling from Wallingford. Richard, go ahead.
Hi. I heard just yesterday that people vaccinated prior to a certain date, it could have been as late as 1990, that the vaccine may not be very effective because the protocol at that point had been to give one shot and not perhaps a booster shot. If that's the case, I would have been vaccinated back in the 1950s. Should I be concerned that the vaccine is still effective if I was given it, or do people need follow-up shots?
Dr. Seaman.
So in the 60s, there was a vaccine that was a different one than we use today that is thought not to be as effective. And particularly among healthcare providers who are at increased risk of coming in contact with people with measles, there are recommendations to get a special blood test to look for those antibodies that I was talking about before. This is called a measles IgG to ensure that people are immune. But the caller is raising an important issue. When we have a huge amount of herd immunity where everybody is vaccinated, we don't run the risk of introducing measles into a population. But when we have people that may have been vaccinated a long time ago, only had received one vaccine, or maybe got this old vaccine that is not as effective, suddenly we get a lot more people at risk for getting measles. So this is why it's crucial to have very, very high levels of effective vaccination in a population.
When you say high levels, more than 90%?
Yes.
Dr. Lisa Seaman is hospital epidemiologist at New York Presbyterian Hospital, also professor of pediatrics, as we talk about immunizations and why there is still concern about vaccinations. You can join us, 860-275-7266. There's also different viewpoints about immunizations. Tim's calling from Portland. Tim, go ahead.
Hi, Howard. Thanks for having me on your show.
Sure. Go ahead with your question or comment.
So my comment was just that I think there's a mischaracterization of people that they're referring to them as anti-vaxxers, and one of your last guests there called them anti-vaxxer wackos. Now, I'd like to present that in our case we would be considered ex-vaxxers, because when we got the vaccine, our daughter became very sick and as now has an autoimmune disease that is definitely linked to the chickenpox vaccine. So I don't think that would be a fair characterization, just to say that it's fear-driven and not based on any experience.
Tim, thank you for your comment. Dr. Lisa Seaman, we talked about this a little bit earlier, but again, as parents and individuals have questions, concerns about vaccines and whether or not, because especially in Connecticut, there are families who can take a religious exemption. So I'm just curious how you respond to someone like Tim who believes there is a correlation between their child getting the vaccination and then causing an adverse effect.
It's very understandable that a family would feel the way Tim's family feels. And what we have to recognize is that we give vaccines to hopefully every child, but sometimes during early childhood, children get other illnesses. But to link that to the vaccine is fraught because it's not what we call causal. It doesn't mean that the vaccine caused that problem. It was just that the vaccine was given before the problem occurred. And lots of times people are looking for an explanation for something as devastating as autism might be for a family. So it's crucial that we provide extremely carefully done studies to uncover any possible adverse effects. And then crucial that we develop really clear ways of communicating the lack of those adverse effects in order to get people safely vaccinated.
You can join our conversation today here on Where We Live, the number 860-275-7266. Erica's calling from West Hartford. Erica, go ahead.
Hi, thank you for taking my call. I think I'm a family medicine physician at UConn Health, and I think this is a great topic to have on your show. So thank you very much for doing it. And sort of this is a great segue from what Tim just brought up. So I'm a family medicine doc. I support vaccination. I promote vaccination with all my patients, and I do have a good subset of patients that don't vaccinate or have a lot of questions about vaccinating. And my approach is that I sit and listen to their worry and their doubt, and I try to clarify anything that they have. And I find that in the end, I can get them to vaccinate their children, even if it's like a broken up vaccine schedule. And so I would love to hear your guests' input about this. Is this a good thing that I should be doing? Should I be doing something different? And how can we, support families who have a lot of questions about vaccinating in order to get their kids vaccinated?
Thank you, Erica, for your question. Dr. Saman.
Well, that's wonderful news. That the real emphasis about what I took away from Erica's comment was the trust factor and the fact that she is willing to take the time to unravel the concerns that somebody might have. What we're learning, and you alluded to this, Lucy, in your introductory remarks, is that there's a lot of false information available to people, for example, because we have so much access to the internet, for example. And it can be incredibly difficult for the layperson to sort out what is truth and what is fiction and what is inappropriate assumption of causation, like I was talking about before. Being able to listen to a family and listen to their fears can be incredibly helpful. I have heard other strategies similar to what Erica has been talking about that have been very effective. I would be remiss if I didn't say that it would require meticulous record keeping on the part of that physician, and clearly adds to the time inherent in a visit. And sometimes not everybody has that incredible desire to do what Erica is describing that she does. But my hat is off to her.
Dr. Saman, when I had my first child, the pediatric practice that we used, they were very clear to families that if they had any reason to not want to have routine vaccinations, that they should find another practice. And what do you think of that approach?
We have heard that approach also, and it's very interesting, and I think not without some controversy. The rationale that those pediatricians are taking is that if you imagine the waiting room that you went into with your baby, there were probably half a dozen little infants that were too young to get vaccinated, as well as potentially immunocompromised people in that waiting area. And if somebody developed measles and came in to the physician to get a diagnosis, they have now infected your baby. And the pediatricians that are saying that to those patients that will not get vaccinated are doing that to protect their other patients. So I think there is some justification for that. Personally, I would wish that it would be possible to talk them into getting vaccinated instead. And I know from other doctors that taking the time that Erica described can really work. But then there are people that will not change their minds about vaccinating their children.
You're listening to Where We Live with our guest, Dr. Lisa Saman, joining us from NPR's New York studios, a hospital epidemiologist at New York Presbyterian Hospital. We're going to fit a couple more calls in before we head to break and talk more about the information that's out there about vaccines. First, Steve and Meriden, go ahead.
This is Steve.
Yes, go ahead.
I had measles in 1963 along with my brother and most of my classmates. And also at the same time, we heard of something called German measles. If I had measles, does that mean I'm immune now as an adult? I'm 62 years old. Secondly, I'll take the answer offline. I also had chickenpox at the same time. Does chickenpox associate with measles, and does that lead to shingles? And could I get shots for that to immune myself if there is problems, or am I, because I've had everything, I already am immune?
Thank you, Steve. Go ahead, Dr. Saban.
Thank you, Lucy. So remember we talked earlier about MMR, measles, mumps, rubella, and the V for varicella. So measles and German measles are two different viruses. There's a very high likelihood that somebody that sounds as old as Steve also had the German measles. I want to add that we have a very safe and effective vaccine for chickenpox, which is given in childhood, often at the same time as the measles, mumps, and rubella vaccine, MMRV. But unfortunately, people who have either had chickenpox, like Steve, or people who have gotten the varicella vaccine may still get shingles, or the word that we use is zoster. And there is a very excellent vaccine to prevent zoster for use in older adults. But this is also something that we recognize the power of vaccines, because zoster can be an incredibly debilitating infection with a lot of pain and discomfort, and that can persist for weeks and weeks. So it's wonderful to add that to our armamentarium.
Sherry's calling from Danbury. Sherry, we have under a minute. Please go ahead.
First of all, I'd like to say I'm not being facetious. This is a public health issue, and I really believe that the people who will not vaccinate should pay for the babies and the chronically ill in my family who cannot be vaccinated. They are exposed due to the decision they made, and the consequences should be rested on the people who had this cause, and they should pay. I think it might affect their decision-making.
Thank you, Sherry, for your comment. Again, some people looking for a firmer consequence when people who rely on herd immunity are impacted by the decisions of whether this is a personal freedom question, Dr. Saman, or the fact that it's a public health issue that should concern all of us.
Yeah, I mean, I totally share the previous caller's concerns. Working in the kind of hospital that I work in, where there are so many little babies and so many immunocompromised patients that have getting chemotherapy or have had transplants, those individuals cannot get vaccinated, and they depend on the rest of us to be vaccinated in order to protect them. And if they get measles, it can be so severe that they could even die. So I really do echo that this is a public health issue that we all are responsible for.
My guest today is Dr. Lisa Saman, hospital epidemiologist at New York Presbyterian Hospital, also subspecialist in pediatric infectious diseases and a professor of pediatrics at Columbia University. This is Where We Live. I'm Lucy Nalpathanchel. Coming up, misinformation about vaccines is only a click away. What can public health officials do better in terms of communicating with families and to combat these low vaccination rates? We're going to learn more after the break. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. What can public health officials learn from the strategies used by the anti-vaccine movement to counter the misinformation so readily available on the internet and social media? My next guest has studied how misinformation is spread online. Joining us via Zoom is Rupali Lume, Associate Director for Behavioral Research at the Institute for Vaccine Safety at the Johns Hopkins Bloomberg School of Public Health. Rupali, welcome to our show.
Thanks so much for having me.
So we were talking about people who have fears about vaccine safety. This is nothing new. Now we're seeing outbreaks of diseases like measles arising. With the outbreaks that have happened in the 90s and previous and today, what has changed in terms of where people are getting their information?
So I think the major issue here is the internet is great in a lot of different ways, but unfortunately, what has happened, particularly around misinformation related to vaccines, is that these user-generated platforms, so social media platforms, if you will, have allowed individuals to get on social media, post inaccurate information, and spread that information. So when you think about a news story is generally checked by some sort of a source to make sure that the facts that are included in that news story are correct. However, that is not the case within social media. And part of the issue with regards to why we're seeing a spread of misinformation related to vaccines specifically is because parents are unfortunately seeing that they're having less and less trust in their providers. So they're turning to these social networks for news.
We heard from a caller earlier who obviously, for good reason, doesn't like to be labeled, whether they're called wacko or even anti-vaxxer. And how does that kind of complicate conversation about between doctors and families?
I mean, I think he made an excellent point, and I think we have to be very careful with the nomenclature that we use. I think that most parents are going to have concerns, right? As a mother myself that has two small children, I had questions about vaccines. And I think what that caller said, as well as Dr. Seaman was saying earlier, I think it's really important to not label people and polarize the debate even further. There has to be some willingness to think about how do we build empathy from a provider perspective with these parents that might have concerns, to hear them out, just as that other caller said, that family physician, I believe, and to think about a way that the provider can enhance trust so that parents are more comfortable asking these questions. They feel like their concerns are being heard and that providers are understanding where they're coming from.
Often scientists will rely on data points to get a message across, doctors as well. And I'm curious, when we think about the stories that are being shared over social media, there's more of a personal connection, even if those stories are inaccurate. What can doctors and public health officials learn from those tactics, Rupali?
I think that we can do a lot better, right? I mean, and I think it's exactly what you were saying. I was saying to someone else just recently that think about the types of information related to vaccines that are posted on social media. Parents usually aren't going to go on social media and say, hey, guess what? I had a great vaccine experience today. They're typically going to go on and post something that happened that was perhaps negative. So I think thinking about these storytelling approaches, focusing on emotions, thinking about ways that we can build empathy, that is something that we should do from a public health messaging perspective.
Dr. Lisa Seaman's also with us, a hospital epidemiologist at New York Presbyterian Hospital. Dr. Seaman, more states are allowing for non-medical exemptions. We heard from a listener who believes people are hiding behind the religious exemption, and that's why they're unable or unwilling to vaccinate their children. I mean, how should states be approaching this from your perspective?
I know that there is talk in New York about eliminating the religious exemption right now. And I think it's really important to understand what that means, because what I am seeing in our communities, because we do serve a lot of the Orthodox Jewish communities, is that there's a lot of diversity even within that community that may not be really appreciable to everyone. So it's very important for us to recognize that there are plenty of people in the Orthodox Jewish community who are vaccinating their children.
My guest today, Dr. Lisa Seaman, hospital epidemiologist at New York Presbyterian Hospital, and Rupali Lume, Associate Director for Behavioral Research at the Institute for Vaccine Safety at the Johns Hopkins Bloomberg School of Public Health. Rupali, when we talk about falsified information, many people still remember that discredited Lancet paper linking, I believe, the measles vaccine with a link to autism. And I'm just curious, again, from your research, ways that this can continue to be discredited, but it keeps getting called up again and again, and people still have that link in their minds. What can be changed other than people continuing to say that there is no link?
Mm-hmm. I mean, it's a challenging issue that we are dealing with. And it's exactly as you're saying, that was discredited. He was stripped of his medical license. But unfortunately, we hear that paper being brought up again and again and again. And I think, again, this ability to get on the internet, seek information that sort of aligns with your attitudes and beliefs allows misinformation to proliferate. I think, I think we can tell people the scientific facts, right? We can talk about evidence-based, and this is what we are finding with regards to the studies that have extensively studied the link, and actually no link, right, between the MMR vaccine as well as autism. But I think, again, it comes down to making sure that providers and healthcare individuals in general are thinking about how do we build empathy with these parents so that they're allaying their concerns and their fears and not dismissing their fears, and trying to think about how do we build trust in them so that, again, parents would be much more likely to listen to a pediatrician or some other healthcare provider rather than turning to the internet to get information that will most likely not be as accurate as you're receiving from a healthcare provider.
Dr. Saman, again, with the outbreak in New York City, I think thankfully no deaths have been reported, but is that something that will be, a possibility considering that the measles outbreak, if it continues, and again, this idea that people don't remember the consequences of measles in this country, it's easier to forego a vaccination because of that.
This is what keeps me up at night, to be honest, that we will have a death. I was part of the outbreaks in the 90s, and we did have a death at that time, and I will never forget that child. The other long-term consequence of measles that your listeners may not know about is a long-term infection of the brain. So earlier we talked about infection of the brain occurring at the time that measles initially presents. But measles has the capacity of actually hiding in the brain, and so it's a relatively rare complication, but it occurs more frequently in very young children. So if a child under the age of 1 is to get measles, they have a risk in the future, upwards of 7 to 15 years later, of presenting with a chronic infection of the brain that is fatal. And that is the other thing that I truly, truly worry about, because the current outbreak has affected so many very young children.
You mentioned living through the outbreaks in the 90s. Again, we are in Connecticut, so the outbreaks are close to where we live. What should people be thinking about continuing this discussion in their communities, Dr. Saman?
I think this is what we're here today for. We have to vaccinate people. We have to get to those very, very high levels of herd immunity. And I think that one thing that I think a lot about is the impact of friends and families on decision making. I think that we know that oftentimes friends and families may have a very profound impact on somebody's decision to vaccinate or not. So I urge your listeners, if they have somebody that they know that's reluctant, to actually speak to them about their own experience and their own understanding of the importance of vaccination.
We talked just briefly, Dr. Saman, about this mandatory vaccination in particular areas of New York City. Are you concerned about people going underground and not wanting to be found out by the New York City government?
I don't think I know. I actually did speak to the health department yesterday about this issue. There are more and more people actually getting vaccinated. And I think that as people are actually seeing real measles, it's making a very, very big impact. We'll only know in the next few months.
Well, Dr. Lisa Saman joining us today from NPR's New York studios. Thank you so much for joining us. We appreciate it.
Oh, my pleasure. Thank you, Lucy.
Dr. Saman is a hospital epidemiologist at New York Presbyterian Hospital and professor of pediatrics at Columbia University. Also joining us today, Rupali Lume, Associate Director for Behavioral Research at the Institute for Vaccine Safety at the Johns Hopkins Bloomberg School of Public Health. Rupali, thank you so much for joining us.
Thank you so much for having me.
She was joining us today via Zoom. Today's show produced by Carmen Baskoff. Thanks to Lydia Brown. Our technical producer is Kyone Wolf. Learn more about our show, WNPR.org/where we live. I'm Lucy Nalpathanchel. Thanks for listening.